Yeah, we're just talking here about the portable neuromodulation stimulator and neurohabilitation. Its recent merger with Helius Medical, and really the future of this device called the portable neuromodulation stimulator. So, I was brought into this story by John Hodge, who you all I think know very well, and I was intrigued right away. I read some of the science that you had sent over. I watched the videos, and then I actually met with Phil a couple of months ago. So I'm pretty apprised of the situation. I've read all the media that I can get my hands on. So if there's something I'm not quite clear on, just coach me along a little bit, because I don't have a medical background.
No problem.
So just saying, PONS device or portable neuromodulation stimulator, that doesn't really give a clear picture of what this is. So what I'm looking for, I guess, is a little bit of backstory from your point of view, how you found out about the device and your diagnosis with MS and how that all came together.
Absolutely. I've been diagnosed. I've been the face of MS. If you look up my name and MS, I became public with MS back in 1999 and really announced it at a press conference in 2000 when I was diagnosed. And my show was on the air for the next 7 years. And I think if you kind of look at my celebrity, I guarantee you that a good third of that is because of MS in some ways, because I became the face of MS worldwide. We didn't really have a character. Before this, it was just Richard Pryor and Annette Fiorancello. And honestly, I think by me being public constantly about it, I've written 3 books about it, people were very interested in how I was coping with and dealing with, and that's really where this device came from, because I was on an airplane. And my journey with MS is a long one. It would take probably 3 hours to cover, but I can tell you that from diagnosis to about 2009, I was in the same pattern that everyone who has MS is in. It is a degenerative disease, and as we get older, it gets more severe. Our category of where we are increases. I was recently put in the category of progressive remitting relapsing by a doctor about a year before I started utilizing the PONS device. Now, I was on an airplane. Literally a person in the back was reading a magazine, and the cover of the magazine was called The Brain That Changes Itself. I was in first class, they're in the back, the plane takes off, the flight attendant, while the plane is still climbing, comes up to me, wakes me in first class and says, "Excuse me, Mr. Williams, will you just take this magazine from me? Because if you don't, this woman's gonna get up and try to run up here to you." We stopped her twice. Took the magazine, looked at it, and I'm ticked because I'm on American Airlines. It's the American Airlines magazine. It's in the back seat of my, "Hey, why'd you wake me up? Like, I barely get sleep. So I'm on a plane, I'm trying to get some sleep." So I put that thing in the back seat. She closed the curtain, so I figured the person couldn't see me. I leaned back, and then I realized, why would someone wake me from my sleep to show me an article about the brain that changes itself? I just pulled it out of the pocket, literally opened it up, and when you read that article, within the 4th paragraph, they're talking about a man who's an older man who has MS, who had dystonic vocal cords, was having difficulty, could not sing, had not sung operatic in 20, 30 years. And as I'm reading through this process, has this man singing again. I'm going, wait a minute, stop. So now I'm reading more. And by about another 2 columns in that article, I literally tapped the guy beside me who was using Skype, which I've never done before on an airplane. I said, "Excuse me, you calling somebody? Can I call somebody with your phone?" He said, "Yeah." I called my assistant on his phone. I said to her, "I got an article, here's what it is, find these people." When I land, I wanted their phone number. And I landed, and my assistant had their phone numbers. And she had already reached out to them, and they said—
The University of Wisconsin.
University of Wisconsin, all 3. Mitch, Yuri, and Phil. She got him on the phone. And she reached out to me and said, "We'd love to talk to Montel Williams. We've been trying to reach him." Now, I'll tell you something very interesting. I didn't find this out until a year later. My manager had approached me a year and a half before with a document from the University of Wisconsin on the PONS device. I looked at it and said, because I saw something on television, I went, "No, come on, not another one of these things." And I brushed it off. I didn't even realize that during this period of time when I'm flying out to Wisconsin to talk to them. I went out there, spent 2 days there, just talking to Mitch and Yuri about whether or not I was going to get involved, trying to understand the science. And I literally went through it, got it, get it. So this might work. But what convinced me was I was leaving, getting ready to fly out. When you see that video that I have, I'm in this long hallway at the very end of it when I get ready to start running. That long hallway is like the catacombs at the University of Wisconsin. It's like a 70, 80-year-old building. 80-year-old building. This hallway is at least 400 yards long. I can see all the way down the end of the hallway, there's two people walking towards me in what looks like doctor's outfits, you know, the scrubs, right? So I'm walking, and I remember seeing this one lady, because she's getting close, I see this lady. She walks out to me, and we walk, hi, Montel, I understand you went over to the laboratory, you talked, I said, yeah, absolutely, I was there, blah, blah, blah. Talking, well, you're gonna have fun here, it's gonna be great. I'm talking to scientists. Walk on, go get in the car. It's the patient that I saw in the video who wasn't able to stand up. 3 days earlier, and I realized, I went back and asked her, is that woman?
Was it Kim? Is that her name?
No, it wasn't Kim. It was somebody who was just there, who happened to just know. It blew me out the door because I'm thinking,
It's Jerry, actually.
Jerry.
The person is Jerry.
Jerry, I'm thinking, is this a patient? And I'm like, okay, so I left. I booked myself the next week and told them I'll be back. And when I went out there, I really literally, my first reasons for going was to smack them upside of the head for claiming things with MS that they couldn't do. And I should back up and tell you, this isn't my first time in this whole world with investigating therapies that are claimed to work for MS. I've looked at all of them.
That's perfect. I have a question about that. Yeah, what else had you tried, or what else had you seen?
I'm on medication. I'm on Eastern medication, Western medication. I'm on a holistic approach that most people on this planet wouldn't be on. I have doctors who've already told me before I started the PONS that it's amazing how well I'm doing, and everything you're doing is adding to it. But what was going on is I was starting to really decline. There was something that was purported, it's going to take a second to explain it, but it's something called CCSVI, chronic cerebral venous insufficiency is the term for it. And I'll give you a story. 5 years ago, a doctor in Italy, his name is Dr. Zamboni, supposedly was a what do they call him, the internal radiologist,
Endocrinologist?
No, the guys who actually go up inside of your veins to operate on you, they're there's a term for these guys.
Interventionists?
Interventionist radiologists. They're the guys who actually do internal look. They go up in your veins with scopes and look around. This guy is a specialist in Italy. His wife had MS. He saw an MRI that came back on his wife that showed, talk real fast, collaterals near her jugular veins, which means that she wasn't getting sufficient blood flow through her jugular veins. So he went up through there, he roto-rooted her. She comes out of the surgery and he says, oh, I've cured MS. So he looked in his little town in Italy of everybody who had MS, found them all, went them in, had MRIs done. Anybody who had MS had a little bit more collaterals than the normal population.
Meaning plaques.
Meaning plaques, and also extra veins. Like, you know, you have your jugular veins on each side. If they're crimped or blocked, your body will actually grow little veins outside of it to help get around the damage. Well, in people with MS, we have, for some reason, in our population, about 80% of us have an enormous amount of collaterals in our jugular, which means that there's some sort of blood flow issue through the brain. And we've always known that from day one. But this Zamboni guy convinced people around the world to start roto-rooting everybody with MS, claiming to cure them. I started getting thousands of emails from people around the world. There have been multiple people who've been killed in this. A person died in the United States. It's banned in the United States.
As a result of the surgery.
Correct. Well, then they
complications.
Complications. They won't blame it deliberately on a surgery because, watch this. The #1 doctor in the United States that does it, his name is Dr. Dake. He's the guy who, a guy died after it was done. He's the guy who did me. Because I want to see the top guy, okay? You think this is gonna work? Let's see. I made him roto-rooter me so I can get people to shut up. And I had to sign releases that said that I might not walk off the table. I had a 40% chance of having, a stroke and blah, 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 but I did this. It did nothing, okay? So I was so ticked. And now I had started the PONS device, but I'm the guy that anytime you say something to me about MS, I'm gonna go check it out. So when this started, I went out there, I jumped in, really thinking that I was gonna disprove it. And what was I gonna do? Just tell them to back off with making these claims. But from the first time I put that device in my mouth, the second session in my mouth, something happened.
And when was that?
4 years ago this September.
2010. Okay, so let's tie it all together. You were diagnosed with MS almost a
1980.
decade before that.
Right. I should have been diagnosed 2 decades before that, but skip that stuff.
That's another story.
Yep.
Sorry.
Sorry.
You had tried numerous other pills, Eastern, Western cures, and then you found this device. So when you started using the PONS 4 years ago, you had just typical symptoms of MS? You had foot pain, leg pain. Tell me what your state was when you started using the device.
Well, I say, okay, my MS has progressed. MS started initially, I'm half blind in my left eye, I have a huge scotoma in my left eye, a larger hole in my vision than you would normally have or most people have. I had left side weakness, I had gait problems, I had pain in my feet, I had trigeminal neuralgia, which means pain in my face. I suffered from what they considered, clinical chemical depression based on the medication I was taking. Also the fact that MS also makes you have depression. It shrinks your brain. We have a squeeze going on. So symptomatically, my symptoms were manageable from 2000 to about 2007, 2008, 2009, 2010. They started to progress. In 2010, I saw one of the top doctors in this country, in this state, who happens to be my doctor, Dr. Calabrese, who said to me, looked me right in the face 2 months before I went to Wisconsin, said, you're gonna stop this bullshit and I'm gonna get you something to help you walk, because you're gonna fall down and you're gonna hurt yourself. 2 weeks before.
What does he say now?
Well, first off, I gotta go see him because I haven't seen him. It's like, I took him off. Every one of my other doctors, my family doctor is Dr. Ligori. Now, I've seen Dr. Ligori along this journey. Dr. Ligori, I hadn't seen, I just realized I went to get a physical. I hadn't had a physical in a year and a half because I'm seeing all these other guys. So I went to see Dr. Ligori, I said, I got to see a physical. I was on the table, he said, oh, what the fuck are you, exact words, my doctor, what the fuck are you doing? How did you do that? He's looking at my legs. My left leg, he had been making notes about the atrophy in my left leg for every visit. He literally was going, it's gone. My left, both of my quadriceps, I didn't even notice it myself. My quads are the exact same size again. Now, for 8, 9 years, my left leg was starting to get smaller and smaller and smaller. My left calf getting considerably smaller because it's atrophying from not being used. My left leg is as big as my right leg. And for my doctor to say that, and then he did a couple more things. So this was just recently, but let's go back to when this happened. So I walked into that facility at 2 sessions in the morning, took a break, 2 sessions in the afternoon. The end of the second session in the morning when I went back to the hotel, I remember distinctly, why am I not crying?
So it changes immediately.
I'm not gonna say that this is gonna happen to everybody.
Sure.
But I'm gonna tell you, I've seen other people, 3rd session, 2nd session, the exact same thing. I watched Jerry's eyeball go from here to here, 2 sessions. And that's a muscular, neurological thing that's causing that eyeball to go over here. 2nd session, she took the glasses off, they were right there. And you look at people, you go, talking to me?
Yeah.
Right? I mean, like for the whole time we're talking, I'm talking to her, it never went back. So with me, I was telling you, again, that first day, it felt a little weird. 2 more sessions, and of course, I'm one of those. I'm that guy. So when they told me you can go home and rest, I went back and did 2 more.
Tell me about a session. What sort of regimen did you start, and what is a typical session like?
The very first session for me, and again, this is about balance, gait, and all those things. It's going to sound a little odd, but the first session is on a balance pad. There's these blue pads that are foam that throw your balance off that they use in rehabilitation for people. First off, when I got there, let's go through this. They put me through a full series of tests.
To get a baseline.
They put me in that stupid phone booth thing. There's this
The
thing.
SOT.
What's it called?
It's called the SOT.
The SOT. They call it the SOT.
Phone booth from hell.
It's a phone booth from hell. It's this. You stand inside this thing. They have to put you in a harness, and the floor and the walls all move.
Independent of each other.
Independent. So you have to stand straight. It's designed to make you fall over. Okay. So any normal people, there's a scale of like 1 to 30. Normal people, if you had no problems at all, you're a nice young guy, you're probably going to score somewhere between 26 and 30. Okay, people who have a little illnesses starts to go down. Most MS people, especially who have progressive or primary progressive, we're somewhere between like an 8 and a 12, and can be below that. And as you go further, it just goes there. I think my first time in that machine, I scored a 12.
Okay.
Could not get back, and I'm telling you, I was trying to beat them. I'm gonna beat y'all. You know what I mean? Couldn't do it. Now, a week later, I scored almost like a 22, and at the end, I scored like a 28.
It's almost normal.
Almost normal.
If not normal.
To normal. So, and in everything that I did, and all those tests that they did to me, every single one of them normalized in 2 weeks. But what was even more amazing about this is that, okay, so again, you're supposed to do 4 a day, I did 6. I don't know if it makes
20 minutes a piece, 30 minutes?
20 minutes a piece, 20 minutes a pop each time. So the first one was on the blue pad. They basically, literally, you block off things to force yourself to work on balance. So you're wearing blindfolds, got on headphones. They put in some really great, wavelength music, but that's really just to make you focus on standing still. So I stand in that position. Now the first time, I'm telling you, Yuri touched me 65 times.
With the device in your mouth?
Yeah, the mouse you're blindfolded and you're standing like this, and literally, because of a person with MS, watch this, with MS before I started using this device, I could not stand like this for even 2 seconds. Now I'm wobbling a little bit, but I'll stop, wait, watch. Now I can stay here and not fall over and hit my face. Well, maybe not, yeah, pretty much. Am I moving? Let me see. I couldn't do this at all. I couldn't close my eyes in the shower without falling down. Because I'm gonna wash my hand, put my hand, I have a rail in my shower, I fall against something, because I lose balance the second I close my eyes. So the first day, they put you on this thing and your body's going nuts and the stimulation's there and you got to figure out how to swallow around it. It didn't make sense. It's the second one. So he did that first, and the second one was get on the treadmill. Couldn't do it. He got that treadmill at the lowest speed. I was able to kind of drag my foot through it. In the afternoon, I went back. I'm staying on that balance pad. Now, for the first 2 minutes he touched me, the next 18 minutes I stood like a rock. And then I got on the treadmill, and I actually made it walk at a 0.9. I tripped. So then the next, I went home. I stood in the bathroom. I just put it in. I sat down and I meditated. And I locked in and meditated. You can also do it on a Swiss ball. But I didn't have it in my room, so I just meditated that evening, twice. Went to bed. Next day, got up. When I got up the second day, I'm telling you, my balance on that ball, on that pad, was almost like I didn't have a balance problem. I remember Yuri maybe touching me once, and then you start to realize that you actually get in the zone that you're supposed to be, because they use the term meditation. I like the term focused thought, because I've never meditated in my life before. Mm-hmm. But I lock in on the thought of healing myself, and I'm telling you, time is gone like this. You stand there, you start, and he goes, boom. I said, wait, are we done? 20 minutes is gone. Same thing when you're walking.
Are you always meditating with the device, or you're doing other things? You were telling me you did some sort of cognitive exercises? Or?
Yeah, those are also cognitive, but I say, okay, so there's the balance, so I stand in balance, and while I'm balancing, I'm focusing on my pain.
Always with the device in your mouth?
Always in the
device. And is there any pain from this device? Does it hurt at all?
No, it's like a 11-volt battery on your tongue, and you get used to it very, very quickly.
So we've all done this when we were like 10 years old.
Yeah, it's like, and then all of a sudden, if you just keep it there, after a little while, you forget it's there. The first 3 sessions, you have to figure out how to swallow around it, because it forces you to over salivate. But then you connect, it just works. And then you swallow. And then from that point on, even when I'm balancing, I'm focusing on healing, I'm focusing on thinking about putting myself in a good calm state. So I'm also working on my emotions at the same time that I'm working on balance. When I get on the treadmill is the second thing. It's not just walk on a treadmill, there's a mirror. In the treadmill, every gym that I go to, I try to find a treadmill that has a reflection in front of it. As long as I can see my feet move, I concentrate. I'm walking. I put my headphones on, and I'm concentrating on my feet and making my feet move out. I'm looking at my left foot to make sure that it matches the right foot. And then as it's matching and I got it matched, I feel it, I close my eyes. And then I'm trying to walk without looking at it and make my feet do what they're supposed to do. The more I do that every day, the better I walk.
So for you were seeing results. I mean, my question was, how long was it before you started seeing results? But it was, in your case, it was the first day.
First day. And I'll tell you one most amazing validation to this. I was married at this point in time for 3.5 years. I got married in 07. I got married in 07, October 07. My wife wasn't able to come with me for the first 3 days. She came with me, she showed up on that Monday. I got there on a Friday or something, she came on Monday. I went to meet her at the airport. She was coming in, I don't know if you've ever been to Madison, Wisconsin, but it's this weird airport where everybody gets funneled to this escalator, and you make this grand entrance down into the baggage claim. Everybody comes down, and people stand there, right? So I'm standing at the bottom of the escalator waiting for my wife to come up, and I saw her. She saw me from the top of the escalator, and by the 3rd step down, she was crying.
She knew.
Because she had never seen my face clear. She never seen my face not grimacing in pain. You can go back on the internet and look at pictures of me, even in red carpets. And you can see it like this. Got this grimace. Why? Because my feet hurt. Okay, sorry. Now I'm emotional because I'm just emotional, but that's when I realized that this was, she said, I've never seen you. I was standing up straight. I walked over to her.
3 days.
3 days. And then from that point, when she said that to me, then I started really working. And I mean, when I say really working, I thought I was already working at that point in time, but now I don't mess around. You know, you're not gonna mess with me, you don't irritate me. When I had this device in my mouth, it's check out.
All right, so tell me, what's transpired in the past 4 years? How marked have the results been as opposed to the first 3 days? Now you've been doing it for 4 years. I mean, I'm sitting here, I'm talking to you, you're telling me your foot doesn't hurt, you're telling me you could stand in the shower with your eyes closed, you're back to snowboarding, you're back
Okay, how about my pain? If I had registered on a scale of 1 to 10 before I started the device, it was at a 6 and I would spike to an 8. I never get above a 2 during the day, and I spike at a 3 when it's a bad day. And a bad day for me with MS is when I'm really tired. I used to not be able to go outside above 84 degrees, 85.
You would have been able to come here today.
I'm fine. I would have been hurting. My feet would have been hurting. Not only that, my balance. I'm snowboarding better than I did before I started using the device because I learned how to snowboard compensating for deficiencies in MS. Now I've got to relearn the whole sport because I'm acting normal. But my left side weakness is gone. My trigeminal neuralgia, which was, and that's where I had pain in my face. You have this nerve that controls all the muscles in your face, and also controls, it has something to do with your breathing. It's called your trigeminal nerve. It's right here, it goes up to here. The fingers go up this way, comes across this way, and goes down this way. It makes everything in your face move, even opens up your sinuses. This whole side of my face, that nerve was so fired. I had doctors test this in Sweden where they stick a needle in here and they can kind of feel, they can see the way you're reacting. My face was on fire. There were times I literally would be sitting there at a meeting, it's just trying to rub it away, right? Gone. I don't remember the last time I felt anything in my face at all. Completely gone, hasn't come back. And again, right now I'm emotional because when I talk about it.
Well, that's a huge transformation.
Yeah. I'm 180 degrees out from the person that I was before I started using this device. And that's the reason why 4 years later, I'm going to do it till the day I drop. This thing, and again, this is not to sprinkle fake dust out here, but on day one, when I walked out of that laboratory on the second week, I looked at all 3 scientists and I said, let me tell you guys, this has to be in the mouths of our soldiers in the next month. I'll tell you what, I'm a board member of Fisher House. Before I went out there, I've been visiting Walter Reed and Bethesda every single month for 3 years. I feed soldiers. So I said that this has got to get in the mouths of our soldiers, and you're gonna help me do this, or I'm gonna figure out a way to come back here and take it and do it myself. So I took all of that. I got the scientists, the provost from the University of Wisconsin, set them up at a meeting at the at Walter Reed with the head of the Washington, D.C. medical complex, who was at the time Colonel Kuntz, who brought over members of the NIH, members of all organizations over there to deal with traumatic brain injury. And unfortunately, just because of communication issues and things, the scientists couldn't talk to the military. I got out of it because I said, my job is done. I'm gonna get this done. Hey, walk away. They're gonna heal my voice. Turn around a month and a half later, and colonels won't talk to this guy, and they won't talk to that guy because they weren't talking the same language. So I jumped back in and I said, this next time I jumped in, I said, guys, we're not gonna screw this up again. And not that they were trying to, but it's just, it's difficult if you've never worked in the military complex to have a conversation with people in the military trying to determine how to work with soldiers who were injured. So I reinserted myself, reached out, found Phil. We had been working on a different project together, and I said, Phil, seriously, man, we can get this done. He agreed, and that's where we brought on Dr. Sakir, who's another friend of ours who works with me on other issues. I brought in Dr. Sakir, and we formed our group to say, we're gonna make this happen. And at the same time that was happening, we agreed to become a company. 2 weeks later, I happened to just be at an event for Fisher House at the Capitol, and the secretary was in that room, Secretary McHugh. And I'm a lieutenant commander in the Navy, right? So lieutenant commanders in the Navy do not touch the Secretary of the Army. You don't touch him. You might walk up and say, excuse me, can I talk to you, sir? I had just walked out of Walter Reed that morning. I had just seen, I'm telling you, I don't remember exactly, but I'm telling you, I saw maybe 10 soldiers. And if the 10 soldiers had 29 limbs between them, and every one of them was an IED issue. Every one of them was a blast concussion. I swear to you, I saw 10 guys. It was the first time I'd been there. I've been there and seen 10 guys, but I might see one guy who just fell down, another guy. All 10 of them were looking up out of that bed at me with complete post-traumatic stress. You could see it, concussive. Their eyes were just not there. They were barely trying to communicate with me. And I was like, I walked up to the secretary, I was crying. I said, listen to me, sir. I just went to Walter Reed this morning, and it is criminal that I saw 10 guys that I could help with something I get to use every day, and they don't get to use it. And the only reason why they don't get to use it is because they don't have FDA approval. I need some help to get this done. And he said, what are you talking about? And I explained it to him real quick. He said, well, what do you want? I said, I just want to come and talk to you. This needs to get done. He looked at me and said, okay, come see me. So we set it up, and a month later, we were in his office. And he said, Phil and I went down there. He had a couple of other generals in the office and people there. He said, we explained the process. We showed him what we had. There's other scientists in the room that were military members. He said, okay, what do you want? I said, I want this in the miles of our soldiers in a year. He said, okay, your work is done. What do we have to do this? The Army then deployed some teams out to take a look at the research, looked at the data. They went out to Wisconsin a few times. 1 year later, to the date, we signed our contract.
So when was that? You signed the contract in February 2013. So a year before that was early.
Yeah,
It was
January 12th.
12, January 12th. January 12th, met with the secretary that day, and a year later we signed a CRADA, and now we are where we are today.
So let's stop for just 1 second, right? Because until now we've been talking about you with your MS symptoms and maybe a couple of other people that were at the University of Wisconsin. But when we talk about this PONS device, we're really talking about the entire brain and anything or any kind of trauma or injury or disease related to the brain. Now, I don't want to put words in your mouth, but what I'm saying is that the Army isn't just interested in this for MS. They're interested for the applications as it relates to, like you say, PTSD, TBI, which is traumatic brain injury.
So let me jump in over that real quick, because I want to make sure that you get this from me. I don't get the wrong impression. I went out there, this device was created for traumatic brain injury, concussive brain injury. They started doing off-indication tests and things like MS because they saw a patient that it worked for. So I lucked out. I went to the military saying, I'm not bringing this to you for MS, I'm bringing this to you for traumatic brain injury. That's what we went after. I'm hoping that down the road, after we solve that problem, I was going to heal myself, but I wasn't really going after MS.
There's some 600,000 soldiers from what I read who suffer.
Correct.
Yeah, so here, what's really sort of paradigm shifting about this is that our whole medical system is built in a platform that says you have symptoms of a disease, and treatments are developed for symptoms of a disease. So we're going to do an MS trial to see if it can relieve symptoms of MS, traumatic brain injury, and a number of different things. What's really fascinating about this technology is it really doesn't care what the source of so whether the balance issue is caused by MS or by a traumatic brain injury or Parkinson's disease, it treats the symptom. It doesn't care what caused the symptom. So it's a very sort of paradigm shifting thought that so when the Army started looking at this, they sort of got it. They said, look, this potentially has applications in many things. So their biggest issue, because they have over 100,000 soldiers today, active duty soldiers that have traumatic brain injury, 30,000 new cases every year, and roughly 20% to a third have permanent issues related to their disorder. So very, very high, and there's been no treatment for the last 35 years other than occupational therapy. So you learn to cope with your symptoms. So this, I think, what really generated the interest is this is actually potentially a treatment for this. Now, everything that Montel has just spoken about his personal experience, is not science. It's an anecdote. It's this PONS working with Montel, and there have been several anecdotes of people treated by the PONS under a what's called an IRB, or a internal review board that sort of approves the study, and they try them and they've seen these kinds of benefits. The reason that we really wanted to form a company and to work with the Army is that we need to prove it scientifically. So we need to do real clinical trials. We need to follow the protocols that require what the FDA requires us, would require to be able to do something like that, so that we can take all of these kinds of anecdotes that are promising and say, wow, this is pretty cool. Now we need to prove it in real science. And so that's what we needed to form a company for, so
Right.
that ultimately we could do the science that would allow the FDA to approve this for the indications that we're seeking.
And so you formed a company called?
We formed, well, Montel, myself, and Jonathan formed the company very creatively, MPJ, Montel, Phil, and John, MPJ Healthcare.
Sounds good though, doesn't it?
It was really creative. And as I said, the three scientists form a company called Advanced Neurorehabilitation, LLC. And it's the two of us that came together with both our skill sets, them on the inventing side and building the technology, us on our healthcare commercialization expertise, and the two of us together formed Neurorehabilitation. And we did that right around the time of the CRADA, so in January 2013.
And thanks to the introduction by Montel, you all have now partnered with the Army. And can you tell me a little bit, either of you, about that relationship and what the Army is promising to do and what they think it can do for our soldiers?
Yeah, so we signed what's called a Collaborative Research and Development Agreement with the Armed Forces.
CRADA.
A CRADA for short. And essentially, the CRADA is in very plain English, and it was written in January and signed in January of last year. And basically, the Army commits to doing everything that's necessary to do the registrational clinical trial to submit this eventually to the FDA. In addition to sponsoring, including the funding for that, and I'll describe the funding in a second here, and to use to sponsor our application to the FDA for eventual approval for the device. So after the signature of the CRADA, we got together, and about a month and a half, 2 months later, and we said, okay, so what are the resources that we're going to have to deploy to do this? And that's when we figured out that it was going to be roughly between $15 and $20 million to do the original pivotal trial. And then said, well, if we've done this first one and we've gotten an approval, there are several other symptoms that cause disability in the Army, so we would like to continue to pursue the research in those symptoms so to see if we can help other soldiers. But all of those symptoms are related to traumatic brain injury. So people who suffer traumatic brain injury have balance issues. Many suffer from tinnitus. Many suffer from sleep disorders. Many suffer from pain and PTSD. So the first one is really, it's one indication, but they want to do it right and do it for this first one, and then investigate all of the other symptoms related to PTSD.
Potentially get approval for each.
And potentially to get approval for each application.
And something else that's really incredible about this CRADA, when you talk about the federal government signing a contract with a third party or an independent company, a private company, they have to have that vetted out by a third party. And a third party was used in this case and vetted us out. But we don't have the exact language in their vetting process. That third party used for us was Booz Allen.
Booz Allen.
And they came back unequivocally telling the U.S. government that they should proceed on this because this is the only thing that can achieve the objectives that they were looking for.
This is an important point I wanted to touch on as well. So basically, go ahead.
I'm sorry, let me describe that because it's a very important point, and it's a part of a process. For whatever commitment the Army makes, and
They don't do anything ready, fire, aim. They do their DD.
Very much so. They sent teams to Wisconsin, and they did the checkout. Then as part of a normal procurement process, and I don't know what the thresholds for this, but certainly this qualified for a threshold to say, have a third party to go, okay, here's what we're trying to achieve with this project. Here are the objectives that we're trying to meet. Please go out and do an independent research.
See if there's a better way to do this.
See if there's a better way, a more cost-effective way. Is there other technologies? And since obviously this was in the context of vetting what we were bringing, we didn't get to see the report, so this is something completely independent on their side that they do from their procurement standpoint. So I've never seen item one. All I know is that the result of that study was, okay guys, we've been able to do the results, and these are complete paraphrase, nobody's ever said this, but they went ahead and obviously went forward with the project. So I'm assuming that the report said, go ahead guys.
There's no better way for
you to achieve the objectives that you have. So I just want to make sure that it's not anything that the Army has said or blessed. But we have to assume what the report was positive.
And we've not seen the document, but again, we all know the processes, and that process is that same third party could have come back and said, skip these guys, forget it, and that's not what happened. So we're moving forward. So we've been vetted out at the highest level, and we're ready to move forward.
Okay, flash forward, go ahead.
Oh, sorry, and then another thing that's so crazy about this is, though, I think where Phil doesn't ever give himself enough credit for what he has been really doing. I'm blessed. Now, I'm the guy who's the idea guy, but I need people that can execute and then be bigger idea guys than me. He already reached out to, when the military came together, we were trying to figure out how to do this all within the military establishment, within their corridors and hallways. We were able to work out to be able to actually utilize some of the funding to step outside of the normal, and this is outside of the normal realm. One of our test locations, I think it's because of his work on this, is one of the number 1, number 2 MS center in North America in Montreal. So our study is going to take place at 3 different centers of excellence in January, all doing this trial for the Fed, but then we're also reaching out to start trials on other indications at the same time. So we're hoping that by the time we're finished our clinical trial January and we start looking at results, we can also be putting forward results from a couple of other trials that we're doing simultaneously. And that's where the funding is coming. It's going to help us out a lot, especially when we start the MS study.
Yep.
So let's flash forward 1 year from last February. We've got a year under our belts with the CRADA. We've just done a merger into Helius, which we'll get into a little bit more thoroughly. And so what's the plan? What's the plan of action now? You say you have some clinical studies coming up in January. You're potentially planning a next generation device. I'd love for you to tell me a little bit about those and when you expect either results, clinical approval, or next generation device.
So from a science standpoint, the most important thing for us is to do, as I mentioned before, do the clinical trials in a proper way under every guideline that's possible. But and obviously the Army's interest was to do this traumatic brain injury series. So all the things that lead down that way. From a business side, our interest is to try and feel what the power or the potential of this device is in different kinds of disorders. So we have the TBI, that's going to be the Army pathway. The second pathway is MS.
It's really important.
Yeah, really important, not only for Montel, but very important for people, and it represents a degenerative disease. So how is it going to work in that particular context beyond the individual kinds of anecdotes that we've gotten so far? And in the third one, we'd really like to do a mental disorder. And we are now going down the path to do Alzheimer's, dementia. So by having a mental disorder, a degenerative disorder, and TBI, that will give us the breadth of being able to really establish the breadth of the kind of symptoms that this ultimately can relieve.
And in that, I mean, can we talk a little bit about the fact, though, that you're already talking with Montreal? They're writing the preliminary trial for MS, but they're also going to be part of our trial for traumatic brain injury. So we're using the same center, which is kind of a...
Well, it's actually two different centers.
It's
the Montreal, the site that was selected for the Armed Forces study is one that is all about traumatic brain injury. The Institute of Neurology of Montreal is actually the one. It's Canada. I've been doing my research too. Canada is the second largest MS diagnosis per capita seems to be a northern disease. So there's a very, very large MS center, and so a separate group is out of Montreal is going to be doing the MS trial.
And when do these begin?
The MS trial is the Army trial is likely going to begin sometime in the first of the year, 2015, sorry, and the MS trial is we're doing a pilot study that will last 3 years, roughly on the same timeline, January of next year. So the same process that we learned from the Army, quite frankly, always start with a pilot. Make sure that you understand every aspect of what the real trial is going to look like. So you can learn and make sure that the trial is going to be positive or give it the best shot to be positive. So we're doing the same thing in MS. So we're going to do 10 patients in Montreal under exactly the same protocol that we would do a full registrational trial to learn. And that's going to take us the balance of the year. And starting early next year, we'll get into the full registration trial in MS also.
But I think those preliminary trials will give us data that I think will be exciting for anybody who's going to be interested in becoming a part of this company.
If the pilot studies that have been conducted so far are any indication, I would, and your results as well.
Yeah, you know, it's interesting. I've been in this industry for 28 years, and I've been a part of 30 different product launches. And usually the clinical trial program is to establish the efficacy of a project, of a product or device or whatever the case may be. And you really don't know how it works. Just the happenstance by which this project is developed, we know anecdotally and through several patients that there's been some effect. Unfortunately, there's been no pure science or real science, comparative placebo-controlled trials, to be able to definitively say this works and this is how it works and these are the benefits that you could expect. But we do feel that it works. I was going to say no again. Here's just we don't know under clinical trial conditions, but we're going to now vet it that way. But the different thought process is we've seen it work. Now let's make sure that the science will be able to back that up.
In a little MS clinical trial that we did, which was a double-blind study, we have done one, and so that one right there shows, and it's almost, and I think Phil will say this, and everybody else who's looked at it feels the same way. You don't see a device like this that has this kind of efficacy across the board. So it would be good for us, and I'm glad and excited that we're going to take this apart, go back and do every clinical trial, and do it again and again, so we can prove it to everybody. But we already have proof, and that proof is in one clinical trial that had a placebo device, and we're going to do it again.
So give me a best case, worst case. Soonest this device can be in patients' mouths as a commercial product, and the latest.
Well, I'll give you the realistic case. What we hope is that we're continuing the pilot trials. That pilot trial should inform exactly how to power our real clinical trial, registrational trial that should start in January of next year. That trial should take about a year for us to complete. So we would be into the end of Q1 16, 2 or 3 months to prepare the filing, and then submission to the FDA, and then 90 days post that. So the realistic point of view that I have is that end of Q2 16, we're approved for launch.
And I'm thinking that along that way, and again, this is, we don't, because something like this, the priority that the government has placed on this as an initiative, we come back with really good data. You know, there are ways that they can deploy this a little bit sooner, or even give us a preliminary order. I mean, government's also going to have to...
Because it's a non-invasive device, from what I understand.
Correct.
Like sort of like a
Non-significant
prosthetic
risk device, yeah.
Like a prosthetic, correct. So we could be in a situation where even while waiting for the definitive final of that, I mean, this is not, I'm speculating, but you know, other devices have been met this way. Some of the prosthetic devices right now aren't fully FDA approved and are deployed under a different kind of a...
The way I understand it is if it's non-invasive and it improves the quality of life, they can potentially deploy it with
compassionate care.
Compassion, right.
The truth is, Andy, that there's nothing that stops us tomorrow morning starting to sell this device because it's been deemed by several IRBs that it's a non-significant risk device. We would have the disclaimer at the bottom, so this has not been reviewed by the FDA, and it's not indicated to cure any product. But that's not the proper route, and it would so undervalue the science that we want to, the real science that we really want to do.
So you don't want it to be viewed as pseudoscience.
Oh my God, no! It has to be. It's so important to the soldiers. It's important to Montel.
But it's important to mankind. I mean, potentially, we're looking at something. If we take the time to do this right, it's not coming out of Montel's mouth. You look at Dr. Deutsch, who wrote The Brain That Changes Itself. This could have the potential of changing brain science forever. So if we do it right, this is just the tip of the iceberg. I mean, the tip of the iceberg is the fact that we've now found a mechanism by which we know we're doing something. As we investigate this more and more, we're going to define what that something is, and it's this goal of this company to not, well, let's say take advantage of, but to actually utilize this science and technology we have to continue to make even greater strides. Because this is just, again, the tip of the iceberg. I've now been able to affect my own balance, I'm saying this way, my own balance, my gait, my emotional well-being. I feel like I've affected my cognitive skills, and I know I have because there's things that I did before and after. It's very funny because we're going to start putting all this data together now that we're finally able to do so. I have IQ tests on me from 10 years ago. There were reasons why I had to take IQ tests after I started this PONS device. And there's things that are significantly changed. I've had tests done along the way, other categories of tests done that things are looking different inside of me. So now we need to actually look at this and get some clinical research on that done.
I'm actually glad you brought that up because I was going to ask you to either of you look in your crystal ball for a second. The first time I met with you, you were telling me you were using this device and playing brain games, brain elasticity games like Lumosity.com or memory improvement. And you said you had seen improvement just...
Yeah, again, it's tough for me because I've been in the pharmaceutical industry. It's not I can't say anything. It's because it's anecdotal. Yes, it's been fun because the Lumosity games are 20-minute games, and I began to do them before I started using the PONS. And yeah, I've seen myself being able to progress faster because Lumosity always compares you to the other to the universe in terms of your percentile performance, and that's accelerated since I've used the PONS. But I mean it's fun and but it's not science.
But something is happening.
Yeah.
But I can also say this. I mean, and honestly, this is now. You just said, can we speculate? Can you crystal ball? Well, let's crystal ball for a second. How about 35 years ago, a television show came on the air, and people took a little square box out of their pocket, did like this, and started talking. Everybody said bullshit. Now we have a cell phone. It was called Star Trek. It was the camcorder. Remember, back then, they also took something and went whoop over somebody's body, and they could tell what was going on. Well, now we have portable MRIs that we can run over people's bodies. I'm going to say if I wanted to take this in that way, under that kind of a conversation, that I would say very clearly, what this does for the damaged brain is a miracle. From just talking hypothetically, is a miracle. What this has the potential to do for the undamaged brain is Star Wars. We're about to change mankind. And I don't, now I say that again in the same conversation as looking at what happened with Star Trek to today. You take a look, take a look at the fighters that they used in Star Trek, and our new stealth bombers look like them. So I'm looking down the road. People smarter than me 20 years from now are going to take this device. I often joked and said, give me Usain Bolt, who's running a 9.6. If I can take Montel Williams, who can't walk, and move me to a 3.2, give me a dude who runs a 9.6, a 9.9, or 10, a 9.900, I'll get him a 9.6.
Talking about nearly doubling your speed on the treadmill.
Correct. I did it. I mean, I've doubled my balance. My ability to keep my body in form on my snowboard is on the other side, and I think this has to do with all the rehab and this. So
we're talking about
speculation.
Kids studying with PONS devices in their mouth. We talked last time about improving your golf swing. I mean, really anything that you would potentially like to improve, and we're spitballing here, but it's fascinating.
It is. It's great potential. I think, quite frankly, before any of those things happen, establishing the medical equity of this device to make sure that scientifically it works in the way that it does. I have no doubt that 10 years from now, those kinds of applications will be a part of everyday life. The PONS and PONS-like device will actually evolve into ways, because I think one of the things that we're doing here is we're finding a portal into the brain, where we found some kind of a portal through the tongue that seems to allow the brain to do stuff that it wasn't able to do before. Now, interestingly, we're not performing surgery, and we're not putting any drugs in anybody. So actually what the PONS is doing is it's somehow amplifying your body's own ability to heal itself. And that's the basic premise of neuroplasticity, right? So what's really fascinating about this is we have it in us to solve these
Hold it up if you want. That's
solve these disorders. So that's what's really, really exciting. So our body has this wonderful ability. This device seems to be some kind of an amplifier that allows us to trigger our body's own self-healing capabilities. And that's what seems to be at play here. But we don't know that yet.
And I want to bring us back to what's really started this. I'm telling you, I didn't walk out of the laboratory in Wisconsin and say, I got to go save everybody with MS. I literally told them, you're getting this in the mouths of every one of my brothers, period. So from my perspective, forget the crystal balling. If a soldier that I saw who was emotionally traumatized, like I've seen with my own eyes, and recognized some of that in their eyes in me when I've had my worst times of MS, and this has helped me deal daily, I win if we just help soldiers. We win. And if you look at the way war is around this world, there's enough soldiers around the world that we've done more for mankind with that alone. All the dream stuff is all the extra. That's the reason for the clinical trials. I want my boys to be able to get this, period. And then we move on to everything else.
And it'd be great. I certainly hope it works.
Yeah.
Yeah, we hope it works too. We really do.
Well, you brought up equity, although you said medical equity. Let's talk about the stock.
Sure.
That is, after all, what
Sure.
I'm recommending is an investment in Helius. So let's get to Helius, which we haven't mentioned yet. We talked about the formation of MPJ. We talked about neurorehabilitation. So take me over what has happened in the past 6 months and how it came to be a publicly traded company.
Yep. So as usual life has it, life is about relationships. It's about somehow Montel and I coming together and bringing our skills, the very different skills, together to form something that neither of us could do alone. And the same thing with respect to how, as I've experienced, funding happens for these kinds of projects. You know, a relationship gets built, and so this was very much the same way. Relationship with an organization out of Vancouver called the Barron Group International. They're a subsidiary of the Barron Group out of Hong Kong. And they're the group that got excited about this particular opportunity. And they essentially acted as our investment bank in being able to raise through subscriptions $7.6 million in subscriptions. So in order to make those as liquid as the investors, to make it attractive for the investors, they proposed to do a reverse merger. So what happened is it was a three-way reverse merger. We had NeuroHab was an independent organization, and then Helius was a shell company on the Canadian Securities Exchange, had no other assets. They bought and purchased the assets of 100% of the assets of neurorehabilitation, and neurorehabilitation then became Helius. So that's how the process. So we essentially merged into a public company, which through that process made us a public company.
And we had multiple meetings, Phil and I, before. We sat down with multiple groups who were all looking at an opportunity to be involved with us. And I think there was expertise with some of the close people that we're working with, one of the partners in this, and we decided to go in this direction. And this was the best way to actually fulfill our part of the criteria, and that is to make sure that we had a proprietary device ready for deployment. And we're right now already contracted with Zymedica.
Actually, that's a great point, Montel. We always keep talking about what the Army's is commitment to this. We have it's collaborative, right? So we have a commitment to the Army that they monitor, and they interview me every quarter and say, okay, how's your part of the bargain holding up? Our side of the bargain is that we need to do all of the design and manufacturing development work, so that ultimately, if this process yields an approval by the FDA and a potential deployment for the soldiers who need it, that there's an actual device that they can deploy, because the device that's shown in the newsletter is a lab widget.
Even the thing that I use in my mouth every day is a lab widget.
It's a lab widget. It's not designed under ISO 9000 or any manufacturing process. So that's the process that and much of the use of proceeds for the money that we've raised is to actually do that design development. And we're now about 6 months into the design development. Everything is on time for us to deliver a fully functioning and
looking forward to seeing it.
It's just a smile on my face, because truly, he says stuff that it's such a trip with this guy. He says it as if, we just talk about it. He was like hounding 12 different manufacturers way back before we even had funding, trying to get some money and set the deal up. So we had a deal set up before we even had funding. I'm going to tell the truth, but we were not up against the wire, but we were trying to get ourselves funded. And so Phil was able to already look and vet out manufacturers, already had them in place, ready to go. We picked the one which was, from my perspective, the best one that we did pick, because the design is like incredible. And the second the funding hit, and the guys knew that we were up against the wire and we wanted a little bit of help, man, the funding came in and we were able to fund Zymedica, and we're off the race. So that device is going to be ready.
It's near.
Yeah. It's crazy.
We're in, by January of next year, we'll have a fully manufacturable.
Maybe I can get a sample.
But other people working in this same position, I think they would have waited until they had funding in place and secured before they even went out to have these conversations.
He was confident it was going to succeed.
Yeah, and he kept us 5 months ahead, just with that alone. So I'm just happy with the fact that
I can't wait to see it. I mean, the sketch that we have, which is in the newsletter.
I'll show you the sketch.
And I'll put it in the newsletter.
Even cooler than this.
So we got to get into just a couple of specifics. We have to do it. Tell me about the shares. So were there shares of Neuro when it was a private company, and what were they valued at, and who owned them? And
so essentially, they were all founders' shares, and MPJ, as I said, MPJ and A&R, or Advanced Neuro Rehabilitation LLC, we had 50-50. So there were 2 million shares, million each, so 50-50 joint venture. Mm-hmm. Part of what enabled us to get all of the design stuff done and is to use some of that equity. So I took a little bit of stock and I worked with the potential design manufacturers, and I said, okay, how do we do something that allow us to start the work so that the day we get funding we would go. So that's how we used a little bit of that equity to incent.
And how do those private shares work? Where does that equity come from? You guys are putting up your own money at that point?
Yeah.
You had
well, we essentially put together. It was all funded by us. The initial funding was all.
So did those shares have a value?
No.
Okay.
For all intents and purposes, they although we did do the full audit, and they assigned a value based on my expertise and commercialization, the value of the IP, and all of those things, which was. It's in the listing statement. I can't remember what the exact dollar figure. It's in the 15 million range.
It's 15,240,000.
There you go.
And so then, tell me how those shares come into being Helius shares.
So
they were exchanged. I'll tell you the rate. It's 16.035.
Correct. So essentially, what Helius bought those shares for 30 million. They converted 30 million shares, bought those 2 million shares. So that's where the conversion happened, and then the Barron Group got a series of shares for the transaction, and so essentially Neuro, what was NHC before, has roughly 54% of the company still. So we still manage the majority of the stock in the company. On a fully diluted basis after the warrants that are potential, because one unit for an investor was the units were 50 cents, were sold at 50 cents, but it also garnered you a half a warrant for 2 years for $1. So that was when you bought a unit, you essentially bought that. And that's how the $7.6 million was raised.
So at this point, we have 15.2 million shares at 50 cents apiece.
Correct.
Okay. And then, according to the filing statement, it says...
that's for the investors, right?
Uh-huh.
And then 30 million shares are owned by MPJ so that's the investors for the private placement. 33 million shares are owned by the former NHC, which was the device manufacturer for the person who had.
And what are those shares valued at, since there was no private?
Before they weren't. So now they're valued at the market price.
The currently trading market price? Or
Currently trading.
Okay.
Currently trading.
So we're at like 2.30 is what I saw today.
Yep.
Okay. And then it says there was 10 million existing shares from Helius. Do you know where?
That is from the investment bank.
Okay, and how were they valued?
They were again valued at the same rate as the initial NHC shares. So they were basically founder shares and became now that they have a public value, became the public value.
Um,
So totally outstanding, if I remember correctly, there's 62 million and change total outstanding shares.
yeah, when you started trading,
Yeah,
60,540,083.
yeah.
Okay.
So that puts us at about $133 million value.
That's exactly what I have. So let's talk about that 133 million valuation.
Yep.
Justified, not justified? Should be more, should be less?
Well, look, at this stage, I think it's a fair representation of where we are. And right now, we're in a place where we have a device that has been anecdotally proven to work through several patients who have used it. We're very excited by the potential for this to work. And then as soon as the potential for this, just the medical potential for this device, there's over 100 million people in the country that suffer neurological disorders of neurological symptoms from varied etiologies. So the potential for this device, should it prove in the clinical trials is in the several billions of dollars. And we expect that the stock will accrue as those milestones are met. And obviously the next big milestone will be the first indication through a review of the interim data sometime in the next January, February.
You can see it here, 140 million individuals in North America alone.
But before I even look at that, one of the things that we do have, it's a preliminary discussion with the military about what the potential first order would be. And our potential first order could be for about 25,000 units, which would be 12,000 for the active and 12,000 for the VA. Well, the military never does anything for just one or two soldiers. If one soldier is going to get it, the rest of the guys who are potential will get it. So if right now we have, let's just say there's a 600,000 total number of traumatically brain injured soldiers, we got 100,000 of them plus 30,000 new a year. If the military starts off by ordering 25,000, within a year they're going to have to at least meet everybody's got to have access. Mm-hmm. So you can't give
that's my buddy here who wants access to everybody.
Well, but I'll also say that if I'm a soldier who suffers from PTSD, and I go over to sickbay today, and you give me something, and I go back to the barracks, and he suffers and he didn't get it, there's a problem.
Yeah.
So I'm just saying, when you talk about justified or not, if we just look at the potential of 3 orders from the U.S. military, that's well into the $180 million in revenue mark with just in selling devices, just for the hardware itself.
So this is a very important point, and I want to be very, very clear.
Give me your caveats.
There's no caveats. What I want to make very clear is that our relationship with the Army is not a commercial one in any way, shape, or form. It is a collaborative research and development agreement to be able to develop a technology that they think will help the soldiers. There is no contract to purchase. There is no promise to purchase. Nothing like that. Obviously, they're developing this in the hopes that they will be able to help soldiers going forward. So we took the demographic or the data independent of the Army, we said, okay, there are 100,000 brain injured soldiers. Of the 100,000 brain injured soldiers, about 30% of them will suffer from a disorder. So there's probably about 30,000 active duty soldiers that require the device. So we took then another 70% cut. We said, okay, so we should be able to, in the active duty soldiers, between 6,000 to 7,000 units up front. And then the same kind of math, again, independent of the Army, looking at the people who are in the VA system, and just saying, okay, how many brain injured soldiers are there, and then what is a normal penetration curve for these kinds of things, which lead us to believe that somewhere between 20 and 25,000 units would be sold in the first 12 to 18 months.
And we're still looking at a price of about $2,500 per unit?
Yeah. And so again, this is not a commercial relationship at all with the armed forces. This is our independent evaluation of what that marketplace, as any company would do, is to look at what the potential is for there. So on the civilian side, once you look at having an indication for traumatic brain injury, obviously sports concussive injury are exactly the same. So when you look, car accident victims are exactly the same, all of those kinds of things. So we hope to be able to help those people in the same way. And at any given time in the US, there's 5.3 million traumatically injured, brain injured people, roughly 1.7 million new traumatic brain injuries per year in the civilian population. And again, a normal penetration curve that's modeled around other devices being put through lead us to the forecast that we've put into the pro forma, which we feel confident in being able to achieve.
You're talking about 70 million in sales by 2017, 100 million in sales by 2018, and just over 141 million in sales by 2019.
Yeah, and I think that's a realistic conservative. Now,
It is conservative because he's also only talking traumatic brain injury. And I'm going to throw in the reason why, I'm also looking at MS because potentially in the United States alone, the numbers are skewed in the United States. If you listen to National MS Society, they're still reporting the exact same numbers for MS patients as they did 17 years ago, 20 years ago when I got diagnosed. So I've done two studies. The studies that we did way back a year after I got diagnosed, this was in 2001 and 2002, Zogby and Gallup both did polls in the United States for the number of people that had already been diagnosed with MS, and it was around 1.3 and 1.8 million respectively. I also have a very big following in the MS community, and I know that this is something that's going to bring, I feel it's going to be something that will bring, once we prove it out scientifically, it's going to bring some relief, the same relief that I've gotten. Hopefully some MS sufferers will have that same potential. So when you're looking at 1.8 million in America alone, and then let's talk about Canada, we talk about Northern Europe. MS community alone, there's probably 7 million people in those three areas, Canada, EU, United States alone, that are potential consumers of this device.
So how many devices are we talking about? Can I just take this 141 million and divide it by 2,500?
yeah, well, there's a little bit of a, because there's going to be a little razor blade model here, where the existing device is one whole, but the future, the commercial product is actually going to have a pulse generator and then
Plus a battery pack?
No, a pulse generator which will include a rechargeable, it'll be rechargeable, so you plug it into your USB port or whatever the case may be, and it will have a disposable tongue array that will be linear or tied to the device. So this part of the device will need to be disposed every 14 weeks. Two reasons for that. The first one is for hygiene purposes and for just to make sure that the array is always performing at its optimal level. And number two, and vastly more importantly, is if Montel walked out of the lab in Wisconsin at a 1 and he continued to walk on the treadmill at a 1 for the last 4 years, he would be at a 1. Really, really important to the continued progress of this because it's not this device that's doing everything. It's always combined with an exercise of some kind, and it's sometimes you forget that that's the therapy. It's the two together, and it needs to be challenging physical therapy that goes along with this. So you're trying to undo or trying to solve a symptom that you're not able to do at this particular point. So every 14 weeks, we want to force the patients to come back to their physician or the physical therapy center to get re-challenged. Okay, are you ready for a new challenge, new exercise, oh, now you've mastered it, you've normalized your balance. Okay, so now let's start working on something else. So there's always a way for the patients to come back so that the device could help solve other symptoms.
And that's a large piece of the revenue stream that you need to include in what we think is going to be the overall sale, because in the civilian world, we will be responsible for orchestrating the rehab. We're already looking at right now partnering up with big physical therapist centers. We end up having to train them. We have to certify them. We're going to have to actually work with them. So there's a second stream in all the physical therapy that goes along with this. And then we're also looking for
to be clear, for us, we don't want to be in the physical therapy business. So that's going to be done by national chains of physical therapists, but they will need to be trained. And we would like to set up a network of PONS certified trainers around the country. The therapy that's tied to this is not esoteric. It's not out of this world crazy. But we really want to make sure that when a patient gets a device, their initial training will come from somebody who understands the combination of the two and how to get.
And what are the sales channels looking like? How are you setting that up?
The sales channel are going to be through likely medical distributors. So the healthcare transaction model will go, prescription comes from the physician. Physician will prescribe both a device and a physical therapy center approved to deliver the therapy. Patient goes, while they make their appointment with the physical therapy center orders the device and delivers the device to the patient. does 2 weeks of daily therapy to learn how to use it, and then gets sent home.
And you're trying to get this covered by insurance as well.
Correct. Yeah, we're in the process now of getting all the proper coding and investigating that whole area.
So we're going to be selling to not only physical therapy chains, but also individual consumers. Will they be able to get
Yeah,
it?
look, they would be able to order the device directly through the physician. Again, if you had a device, there has to be a prescription for exercise that goes along with the device. So getting a device and going into your medical device store and buying a device without properly being
You
trained.
go home and sit, well, it's not going to do anything. You go home and sit down on your couch.
Yeah.
You sit down on your couch and just stick this in your mouth and watch TV, nothing.
Yeah.
But you can teach yourself how to sit down, skip the TV. You can sit down by yourself in a room with the device, and I listen to wave music all the time and concentrate. So there's things that you have to do. You can't just stick it in and think it's going to do something for you.
So quite frankly, we would be much, much happier to let this device go out under very, very controlled circumstances to make sure that it's used properly and to build its medical equity. Because there's a lot of people out there. It's gonna, it's just another TENS machine or another neuro. It's very, very different pathway. Definitely. And nothing like this has ever been done. So we want to be part of serious medical treatment. We don't want to be part of anything outside of it.
The TENS analogy is a really good one because I've used TENS before. I have a shoulder rebuilt, I had a knee worked on. So you go home and you just plug this thing up. It's a stem device. That's not what this is. So you can't plug it up and just think it's going to do its thing by itself. You have to put this in and work at it. And when you work at it, I say over and over again, it's the gift that keeps on giving. Because the harder I work, the better I feel. I know it, and because again, we're figuring this out, and we'll do so when we do trials with MS. MS and diseases like mine that have an ongoing etiology, where this disease is progressing inside of me. Nobody should walk away from this conversation thinking that what we're doing is curing anything. I'm just impacting my symptoms and making them so much better. Am I changing my brain along with it? I don't know, but I know that my leg's working better.
And it's an important takeaway that it doesn't just stop the progression of the symptoms, but in some cases it improves them. So we're not talking about just stopping you from getting any worse. We're talking about improving what you've already lost.
You can see what I was getting worse, and now there is a constant improvement on, I think, almost every symptom that I had. And what's so weird about it also is I say to Phil, until somebody brings it up or says something, I go, oh, wait a minute. You're right. It's like, people like me, I'm not afraid to talk about it. People with MS, we have all kinds of symptoms, everything from bladder symptoms to intestinal problems, whether or not they are incontinence or the opposite of. And I've had issues, but I didn't even realize it until about 3 or 4 months ago. Some of these things I stopped thinking about. I just don't even think about them. And things that I just do now that make me feel so much more normal than I did from day one. And it's this.
It's very rare that you get this sort of, benefit for humankind and an emotional connection to a product that also has such a bright financial future as well as it relates to an investment. What is the ultimate goal or the ultimate strategy for an exit? I mean, where do you see Helius in 3-5 years? Are you looking for growth, sales growth over the next coming half decade or decade? Are you looking to sell to a larger conglomerate?
Look, right now we feel that we're developing not so much a medical device company, but a platform. So there is, PONS 4 is the next one that's going. It's the one that's going to be as the next generation. There's going to be PONS 5, 6, 7, 8. There's no doubt in my mind that someday your cell phone will have a pulse generator, and you'll put an array in there, and you'll put it in because it'll be part of our of how we treat these symptoms. So my biggest priority is to make sure that we do everything not only by the book, but that we prove the science and invest in finding out what is the science, what is happening in Montel's brain, what is happening in other people's brains that this technology is enabling. And once we figure that out, there's going to be a PONS avenue this way, a PONS avenue that way.
You're talking about PONS MS, PONS Parkinson's, PONS.
Yeah, because we don't know. Today we have a device that works generally well in all of the conditions that it's been tried in IRB clinical trial settings. But we don't know if under for depression, whether a different pattern of stimulation or a higher or lower would be even more effective in that side. That science is yet to be done. So we fully expect that 2 or 3 years after we commercialize that we're going to generate interests in large medical device companies that see this as a platform and will want to bring this platform into their organization and would have the resources to make this a whole branch of science. Interestingly, I just looked at the neurostimulation, an audit that was, not an audit, a syndicated study that was just done. It was done in January of this year, and non-invasive neurostimulations, not even part of the definition of the market they looked at when they looked at that. And they say it's going to grow by 14% per year for the next 10 years is what they're forecasting. So it's not even, our technology is not even on that radar screen yet. So as we develop the science and as the science is legitimized through the clinical trial process, I think we're going to garner a lot of interest in people who are already in this marketplace to potentially acquire us 3 to 5 years post launch.
But I'm hoping that no matter what happens there, I don't intend to ever not be a part of this, because there are things, and Phil will tell you, I mean, again, in the pure medical area, I think we should take this out as far as it can go. I mean, 10 years from now, there's really no question where this might be, because we are actually sending a signal. We're stimulating the brain to heal itself. So potentially this could have all kinds of implications down the road, implantable, all kinds of things that we're not even thinking about. Science is going to break to it, but I want to be a part of that discussion as we move this thing forward, because I think eventually the simpler things, the things that I don't even want to pay attention to, like sleep. I'm telling you, this changed my sleep pattern completely in life. It's not whether you have MS or any other disease. This is something that people could utilize instead of taking drugs, I think, or potentially could. So there's those kinds of things that I want to be able to work on, down the road. Now I'm going to be using this until the day I drop, so I just want to stay involved.
I was going to ask you to sum it up for me nicely, but I think you just did it. So I'll end with him finalizing with sort of this. Give me the elevator pitch on, if I'm watching this today, why I want to invest if I'm interested in biotechnology investing, or I don't want to say sustainable investing, but double bottom line investing where we're helping humanity as well. Why Helius?
Yeah, because I really think that we're onto a new portal into the brain. And through Helius and through our partnership with the armed forces, we're going to be able to develop a technology, or we are developing a technology and proving it medically that potentially could treat virtually any neurological disorders. There are, if you listen to one of the inventors, Yuri Danilov, there are 1,400 different neurological disorders that this has potential for. So for our potential investors, get in on the ground floor of something that could be a whole new branch of medical stimulation is what Helius promises.
CEO Phil Deshchamps, Montel Williams, I appreciate you guys coming down to Baltimore to talk to me about this today. It's a fascinating story. I hope it gains traction with the readers, and I hope it not only helps our soldiers and people struggling from brain diseases, but also potentially make some subscribers some money as well.
Cool. Thank you.
It's my pleasure. Thank you.
Thank you.
Thanks, guys.
Absolutely, man. Thank you.